Hi, my name is Stephanie Stanton, and this is my personal testimony on how I healed my ruptured disc without the need for surgery. First, let me say that if you are someone currently suffering from a herniated or ruptured disc or any back injury for that matter, I sympathize with your pain. I understand how difficult this time is. In my personal journey, when I was doing research to find an alternative to surgery, I discovered that an average of 70% of people here in the United States actually suffer from lower back pain. And that might be slightly higher now, but at the time, that was the current statistic. And that many will find that if they have a herniated or ruptured disc, that they think surgery is the only option, oftentimes because that's what their doctors are telling them. However, despite what the traditional medical community may say, only 5% of back-related injuries actually require surgery. So I think that that's encouraging and something to be aware of. In my personal journey with recovering from a ruptured disc, I had suffered through 8 months of pain while I was trying to find a solution to heal my back without surgery. So hopefully you can benefit from my experience. This is me before I injured my back. At the time, I was a very healthy individual. I was working out with a trainer. I felt fantastic. And prior to my disc rupturing, it literally felt like my back went out overnight. Even though my back had been slipping for many years, at the time I wasn't aware of that. And so it was very confusing how I can go from, feeling great to waking up with a extremely herniated disc literally overnight. Now, important to note with my particular case, I had ruptured my L4, L5 10 years prior. And at that time, I did have a partial discectomy to fix my back. So this was a re-injury that was occurring in the same location on an already operated on disc 10 years later. So what were my symptoms? My symptoms were that I couldn't walk, I couldn't sit. Laying down was also very painful. I had radiating pain that went down my right leg that followed the nerve path you see in this photo, this blue path. I wasn't able to support my torso, so I was hunched over most of the time. If I were to try to stand, I couldn't. The pain was constant. Nothing relieved the pain. I was on pain medication, but that didn't even help. And as a result, I was completely bedridden. So if you're suffering with a ruptured disc or even a herniated disc, you're probably going through a lot of this similar symptomology. And if your injury is in the L4, L5, S1 location, it's probably going to run along the same nerve path. I also had compression in the S1, so I did have some pain going through the toe as well. So I just thought it would be helpful to kind of take a look at what is really happening and what a ruptured or herniated disc looks like. So you can see in this diagram there are 4 stages to a herniation. On the lower end of the spectrum, you'll see what is often referred to as a bulged disc, and then as it progresses, it goes into a herniation and ultimately a rupture. And the pain is coming from the fact that the disc material is sitting on the nerve, pinching the nerve and injuring the nerve, and so the nerve gets inflamed and very raw, and that's where the pain is coming from. So with traditional treatments, you may find that your doctor is recommending you get an epidural injection, which is a cortisone injection. It's a steroid that gets injected into the back. And the idea there is to hopefully reduce the inflammation around the nerve to create enough space between the nerve and the disc matter to relieve the pain. I have had these done and they didn't work for me. Most people find that it doesn't work. It's not really great to have cortisone in your system either. But that's a traditional treatment. And then if that doesn't work, most of the time the doctors will then say, well, let's have surgery. And the surgery seeks to cut away at the disc material to relieve the pressure of the nerve. Then the nerve will heal, and then the pain goes away. So just so you have an idea of what is really going on, that's what's going on. Now, in my case, I was told that I had a 12 millimeter rupture, which is a very significant rupture. And the neurologist and back specialist that I had seen all told me that because of the size and extent of my rupture, surgery was the only option for me, and that I would never walk again unless I had surgery. And because I had had a prior discectomy, they would have had to fuse my back, which would have created more instability in my back. And research also shows that people who have back surgery oftentimes will have subsequent surgeries. So that would have been going on my second surgery, and I would probably suspect that in years to come, I probably would have had a third, possibly even fourth surgery. So my thought here was, well, hey, since I already had a discectomy on that disc and it re-ruptured again, and there had to be something going on in my body structurally that was causing this to happen again, because I didn't do anything. I didn't lift anything. I didn't cough too hard. I didn't work out with my trainer and throw my back out. So something was causing this. So the question that I sought out to seek was, what was the source of this rupture? And so with that in mind, that's what I focused on finding the answer to. And, my philosophy in life generally is that the body can heal itself, and that with faith in God, anything is possible. So with that as my mindset, I was determined to find out, again, the source of the injury, and I had faith in the Lord Jesus Christ to lead me to the way to heal it without the need for surgery. So here are some alternative treatments that I tried that I found did not work. So this I thought might be helpful for you to know as well in your journey. A TNF injection is something I did have. It's a newer treatment for herniated and ruptured discs. The claim is that it works similar to an epidural injection, but with much better results. The idea is to reduce the inflammation around the nerve to stop the nerve pain. Unfortunately, this did not work for me. TNF injections have really bad side effects. It was very expensive. It was I'll just tell you, it was a $5,000 injection, so it was extremely expensive, and it is not covered by insurance. I did have this done, and it did absolutely nothing for me. So if you discover this in your research, I would stay away from this. I also tried traditional physical therapy and pain medication. That did nothing. The pain medication helped a little bit, but it wasn't a solution, obviously. And then I also tried some alternative healers, because at this point I kind of said to myself, hey, I'll try anything, but again, nothing worked. So as a result, I was bedridden for 8 months, and during this time I had my iPad and I just sat in bed and research and research and research. And it wasn't until one day when I was having a conversation with my grandmother when she said, hey, Steph, I know somebody who has low back pain, and they discovered that it was related to her lower jaw. And I said to myself, that's kind of odd. What would the lower jaw have anything to do with the lower back? But I researched the connection or the correlation between the low jaw and the lower back, and that's when I discovered the atlas vertebrae, which then led me to what I'm about to share with you. But I just think it's important here to note too that this was at a point when my family was basically telling me, knock off the research and just go get surgery. And it was my husband who was my cheerleader, and he kept the faith with me. And it was because of his support and faith that I think I was really able to push through this last month of my journey, because it was getting very daunting. So I just want to take a moment here to say, if you're kind of in the same spot as I am and kind of losing faith, don't. There is hope. So here's what I discovered. I discovered that our C1, or our atlas vertebrae, which is the very first vertebrae in our spine, is what determines the alignment of our spine. It plays a key role in how all of the other vertebrae in our spine are aligned. So you can see in this diagram here that when the atlas is aligned properly, our spine is aligned properly. And when it is not, it throws the entire back off. So in my particular case, my atlas was so severely out of alignment that it was twisting the lower part of my spine, which was causing the ruptured disc. So this was a really interesting discovery. And again, here you can see an even better diagram of this, that when the atlas is misaligned, it throws the entire spine and the entire skeleton out of alignment. And I was soon to discover that this is exactly what was happening with my body. My whole skeleton was collapsing because of my atlas. But at this point in my journey, I didn't know that that's what was going on. So I started to research atlas orthogony, and I was able to find an atlas orthogonist in my area. His name is Jeff Middleton, and at the time, he was the only orthogonist in Florida that had this machine. And I will say that if you do decide to get your atlas checked, be sure that the atlas orthogonist you go to has one of these machines and that they don't adjust your atlas manually. So that's important. So we contacted Jeff Middleton's office and scheduled an appointment. And I was so bad at this point in my journey that my husband had to literally carry me into his office like a baby in his arms because I couldn't walk. I arrived at their office in the back of our Jeep. We had to put a mattress in the back of our Jeep because I wasn't able to sit. So I was literally carried into Jeff's office, and I really didn't have any idea if this was going to work. So it was kind of like my last hurrah, if you would say. But logically, it made sense to me that if my atlas was out of alignment, that it very possibly could be the source of my rupture. But at this time, I was just kind of going on faith, we would say. So my skeleton at this point was collapsing. My patellas, my knee caps were on the inside of my legs. My SI joints were dislocated. I was a mess. And I still had my 12 mm rupture. So when Jeff x-rayed me, he did discover that my atlas vertebrae was severely misaligned, probably the worst he had ever seen up to that point. And lo and behold, this was the source of my rupture. So praise God that, he led me to discover that through Jeff. So Jeff aligned my atlas using the machine. It was absolutely painless because the way the machine works is it sends a puff of air, which sends a vibration through to very strategically align the atlas. And when I sat up, my husband noticed that my patellas literally popped back into place instantly. It was fascinating. And then Jeff said to me, "Okay, Steph, get up and walk." And having been bedridden for 8 months, my first thought was, I don't know if I can do that, but I did. And lo and behold, I had absolutely no pain. I mean, it was literally like a miracle instantly. I had no pain. I could walk. I could sit. It was amazing. And so after that initial session, um, I was able to walk out of the office. I rode home in the front seat of our car, and I felt so good that my husband and I decided to go have lunch for the first time in 8 months, and I sat through an entire lunch and I was fine. And it was only from one adjustment, guys. I mean, that was mind-blowing to me. Subsequent to that first session, I had a few other sessions where Jeff had to realign my SI joints and tweak a couple other misalignment issues. But once that was all addressed, I was fine and I never went back to Jeff. So, you know, it wasn't something where I had to keep going back year after year, week after week, like some people do with some chiropractors. And if you find that you're in a situation like that, where you're with a chiropractor for years and years and still working on the same alignment issues, I would highly recommend you get your atlas checked, because that's not normal. It shouldn't be that way. So praise God, the atlas got aligned and my pain was gone and no surgery needed, guys. This is Jeff Middleton. He's the atlas orthogonist that I saw. He is incredibly talented and gifted. His office is located in Fort Lauderdale, Florida, and here's his website and phone number for those who are in the area or willing to travel to see him. I highly recommend you make a call to him, and if you can get to Florida, go see him. There are people from all over that come see him. They do make the trip because it is worth it, especially if you're going to get healed. And let me just say too, that Jeff does more than just orthogony. He specializes in laser medicine. He does nutritional work with people as well. And when it comes to aligning the atlas can also, when it's aligned properly, help people who suffer with fibromyalgia, diabetes, just a whole array of things. So getting our atlas in alignment is more than just helping to fix back problems, because when you look at the spine, you know, we know that all of our nerves run out of the spine. So when the spine is misaligned and it pinches those nerves, it's going to affect the organs and the systems and all parts of our bodies where those nerves feed. So it makes sense, right? So even if you suffer from things like fibromyalgia, or any ailment that you kind of find that the medical community is letting you down and you can't find any answers, it may be worth having your atlas checked. And for those who can't make it to Florida, here's a link to the global directory so you can find an orthogonist in your area. But remember, make sure that they have the machine and that they don't just manually do it. And the other person I would like to acknowledge is Kim McDonald. She is a physical therapist who did myofascial release on me, and she also gave me muscle rebalancing exercises. And this was a significant part as well of my healing, because when our spine is misaligned and it throws our skeleton off, our body compensates by will compensate, and as a result of the compensation, our muscles become imbalanced. So people who have back issues have muscle imbalances. Actually, most people have muscle imbalances, but especially people with back issues. So those muscle imbalances will need to be addressed. But myofascial release is something that I would also consider looking into as part of your healing protocol, because it's like the body will get knots, for lack of a better word, And those knots, the gummed up fascial tissue needs to be worked out and released, and that's going to also help with functionality and mobility. And so here is Kim's contact information if you'd like to reach out to her. She's also in Florida, but could possibly recommend another myofascial therapist in your area if she knows of one. And lastly, this is my contact information. Please feel free to reach out and ask me any questions, or if you just want to talk, I'm here. My message to you is don't give up hope. Healing is possible. Keep the faith, and definitely consider having your atlas checked out. I'm not saying your atlas is misaligned, but I'm saying if it's misaligned, this is where you want to start your journey. And again, keep the faith, guys, and all glory and honor to Jesus Christ. So God bless you, and thank you for watching.